I'm Dr. Robert Anderson. I'd like to take this opportunity to talk a little bit about a procedure that's become extremely useful in our in vitro fertilization laboratory, especially in the recent year. Preimplantation genetic diagnosis, or preimplantation genetic screening, is a really single procedure used for two different purposes, which has become very, very important. This procedure allows us to determine genetic information about embryos prior to placing them back into the person who they came from. And what's done is the cell or cells are removed from an embryo either on the third day or the fifth day, and these cells are then sent to a special laboratory where the genetic information is obtained prior to us transplanting the embryos back into the person. In the older technology, which we had for the last 15 years or so, this procedure wasn't really as helpful as it could have been. The older technology was done by a procedure called fluorescent in situ hybridization, or FISH, which initially allowed us to only test 5 chromosomes out of the embryo. Unfortunately, since there's 23 pairs of chromosomes, this left a lot of information that we weren't able to get. Over the years, the number of chromosomes testable with FISH went from 5 to 7 to 9 and eventually to 12, but even then that was only half the information. The large studies done on efficacy for this procedure didn't really show that the pregnancy rates were any higher for women who had either recurrent pregnancy loss, failed in vitro fertilization cycles, or advanced maternal age. And so this procedure really wasn't as useful as it might have been. Recently, a new technology has become available which has changed all that. The technology we now use is called comparative genomic hybridization, or CGH, and this technology, in contrast to FISH, allows us to test all 23 pairs of chromosomes. So now, whenever we do this test, at least we're getting all the information that we need, and it's therefore become much more useful. The other application for this technology is preimplantation genetic diagnosis. This refers to testing for a single gene that may cause a specific disease, so that the embryo can be excluded if it has the disease and placed back into the woman if it doesn't. Some examples of diseases that are treatable and diagnosable with preimplantation genetic diagnosis are on the following chart. As you can see, there's quite a number of diseases that are now able to be tested this way because we've been able to identify a particular gene that causes that disease. The technology that we use in the laboratory involves a small laser which makes an opening in the outer portion of the embryo, or the zona pellucida, prior to extracting a single cell if the biopsy is done on the third day, or allows us to cut off a significant number of cells from a blastocyst if it's done on the fifth day. Let's go to the laboratory and see how this is done. What we see here is an 8-cell embryo being held by a holding pipette on the left. The red circle is the target area for the laser that we're going to use to make the opening in the outer shell, or the zona pellucida, of the embryo. Look carefully at the inside. You see a clear space as the laser is being fired twice to make the opening. Then a blunt pipette comes in from the right side and a pressure is applied to help to squeeze one of the cells seen there near the top out the opening that we've just created. And once the cell has been completely squeezed out through the shell, the biopsy is completed. Preimplantation genetic screening, as we've now seen, is an extremely important procedure. However, because it is a brand new technology, there still are some limitations associated with it. Firstly, anytime an embryo is biopsied, there's potential for damage to be done. This is primarily something that we see when the procedure is being learned by the staff in the laboratory. As they do more and more of the procedures, this becomes less and less of a problem, and in our hands, we seldom see embryos that are damaged in this way. Secondly, there's a phenomenon called mosaicism. This refers to the fact that not every cell in an embryo necessarily has the same genetic makeup. Therefore, if a cell is removed on the third day, for instance, when there may only be 6 to 8 cells total, that cell may or may not be representative of the makeup of the majority of the cells in the embryo. The estimates on this are that we're probably seeing that less than 10% of the time. To minimize this, if the embryos are done at the blastocyst stage on day 5, many more cells can be removed, and this limits the chance for mosaicism to be a complicating factor. Therefore, we still feel that this is an important procedure and an extremely useful procedure, and I think that over time, the large studies will show that pregnancy rates are indeed increased compared to situations where preimplantation genetic screening is not performed. In another video, we'll examine the outcomes of preimplantation genetic screening with respect to age and talk a little bit about the effects of age on fertility.